Hi there, it's Justin Lubino with Senior Advisors, and we've created this video in the past to provide an overview of how we pick the most cost-effective Part D prescription drug plan. And it's using a tool that's on the Medicare website. And this video, it's now March of 2023, and the last time we did this was back in August of 2021. So there have been a few updates with the tool, so that's why we want to do an updated video. The same functionality still applies, but there's just a few nuances that we wanted to review in this video. So we're going to walk you through, again, how to use the Medicare Plan Finder to find the most cost-effective drug plans. The first thing you're going to do is you go to Medicare's website, which is medicare.gov, and you click underneath Find Health and Drug Plans. You're going to click the Find Plans Now. Then you're going to have to enter in your zip code, and you're going to select the plans that we're looking for. So I'm going to use, for the purposes of this example, I'm just going to use our office zip code here in New Jersey. And I'm going to select that I want to search for Part D plans and click Apply. And then you click Start. The next question it's going to ask you is if you get any additional assistance, such as Medicaid. For this example, I do not get any extra help from any of these programs, and click Next. Then you ask if you want to enter in your drug costs. Well, yes, that's the purpose of this example. We want to enter in the drugs to see what the drug plans are going to look like. And then you have to put in the prescription. So we're going to do a couple of examples in this video. The first one is a pretty simple, low-cost situation where someone is taking two medications. One is a blood pressure generic and then a cholesterol generic. So for the blood pressure, it's called lisinopril. If you see, I typed in a few letters, and it starts to pre-fill the different options. So you don't have to know the exact spelling of the drugs. It kind of will guide you through that process. Then you click Add Drug, and you have to select the dosage. So you can change to the correct dosage that you're currently taking. For the purposes of this example, I'm just going to assume the default, and we'll say 30 per month, which is basically that you take one pill per day. And then we're going to add that to my drug list. And we're going to add one more medication just for this first example. And it's another, this one's the cholesterol med. You can see I mistyped the letters there, but it still shows me the correct spelling below. Torvastatin is the cholesterol med. And then again, we're going to select the dosage and the frequency. We'll just keep the defaults here and add to my drug list. So for this particular example, the individual is just taking these two medications, and then we click Done Adding Drugs. The next section is where you select your pharmacies. So you can choose up to 5 pharmacies or 4 pharmacies in mail order. I'm going to choose the mail order, and then we'll choose a couple of local pharmacies and then a couple of national. We'll put the Walgreens and CVS in there as well. And then we're going to click Done. And by the way, here's a map where you can see different pharmacies and locations of where they are as well. Once you click Done, now the tool is doing all the work for us, and it's calculating the total overall expense for the year. For each of those, there's 24 different drug plans available in this area. Most states have about 24, 25. And what it's doing now is it calculates the total cost, which is the premium plus the cost of your drugs for each of those 24 different plans. And then it automatically sorts the plans based upon the lowest total cost. So we're not just looking for the lowest premium. We're not just looking for the lowest drug cost. We're looking for that lowest total cost to find which is going to be most cost effective. So in this example, the plan that came up most cost effective, it's called WellCare Value Script. The premium here is $9.30 per month. That's what you pay for the insurance. It does have a $505 deductible, but once we look into the details, we're going to see this only applies to higher tier medications, and it won't impact these drugs. I'm sorry, these drugs will not be impacted by that deductible. Now, here's the key number we're really most concerned about, which is the total drug and premium cost for the rest of the year. So this is always the rest of the year, and it's looking at the first of the following month. So we're in March of 23 right now. So it's looking as of April 1st of 2023 through the end of December. What is the total drug and premium cost going to be for this? In this example, it's $83.70 for this plan. So that includes the $9 a month. And then as you'll see, there's no drug costs because these are tier 1 generics for this plan. But if you scroll to the next one, you'll see that this next plan has a lower premium, $6.80, but the total cost for the year, which includes the premium, it includes the deductible if it applies, it includes the drug costs, all in that total number is higher. So even though the premium's lower, your total cost would be higher with this second plan. And if you keep scrolling through the list, you're going to see that number keeps going up because the total cost is higher as you go through these plans. So the point is, we're not just looking for the lowest premium. We're always trying to find the most cost effective based upon that total cost for the year. Now, the other thing I want to show, there's a lot of great information here. If we go into the plan details, we'll see more information about the plan. Again, it's going to give us that monthly premium. It shows us the total drug cost for the year. So if we go to a pharmacy, we can see it's $0 for the year. If we use mail order, it's also going to be $0 for the year. And we're going to get into more detail about how they come up with those numbers as we scroll through the page here. Before we get to there, though, there's more information about these pharmacies. You can see we put in the 5 pharmacy options. It shows us that which ones are going to be preferred, which ones are just in network, which ones are out of network if we selected out of network. But the preferred pharmacies are generally where you're going to get lower cost sharing for that particular plan. So this next section here, it shows yearly drug costs by pharmacy. So here's where you're going to see for those preferred pharmacies, it's zero. There's no drug cost for these drugs. When we do the second example, we're going to add in some expensive drugs so you can see where it shows us the cost of those expensive drugs. This also shows if you go to one of these other pharmacies that is in network, you're going to pay a higher cost for your medications because it's not a preferred pharmacy. So the next section shows us the estimated total drug and premium cost for the year. Again, this number here, that 8370, is the number that made us select this plan, right? This is the number that brought this plan to the top of the list because this is the lowest total cost for all the plans that are out there for this particular example of drugs, right? It also shows if you're going to meet your deductible and when you would meet your deductible. And then if you're going to enter the coverage gap, which is also known as the donut hole, it'll let you know which month you're going to reach that coverage gap, and then which month you're going to exit the coverage gap if you're going to exit and get to catastrophic coverage. Now, these different phases are explained in other videos that we've created that explain how Part D of Medicare works. So I'm not going to get into that here, but we have another video out there. It's about 10 to 15 minutes that explains all these different phases within Part D, the deductible, the coverage gap, and the catastrophic level as well. So the next section breaks down the monthly drug cost. So you can see, again, this is kind of a silly example because it zeroes all the way through. When we look at the next example where we have some expensive drugs, we'll see how it changes by month as far as the drug cost goes. Then we get down to the drug prices for each of those pharmacies. So this is where you'll see the monthly cost and the retail cost. You can see cost before deductible, cost after deductible. If you reach that coverage gap or donut hole, what you have to pay, and then if you reach the catastrophic level, what you're going to pay for those drugs. Again, those are all explained in another video. And then it just does that, repeats that for each of those 5 different pharmacies, so you can see all that information there repeats. Then you have a section here that gives you even more drug information about the different tiers for the particular plan, what you're going to pay. This is a 6-tier plan. You can see 1, 2, 3, 4, 5, 6. And for depending on the tier of your drugs, you see what you're going to pay as far as the copay or coinsurance goes for those medications. Then there's more information about the drugs. If there's any sort of prior authorization or quantity limits for these medications, you'll see that, or step therapy. That will all be defined in this other drug information section. And you can see if there is a quantity limit, you can click on it to see the most you'll be able to get for this particular medication is 30 every 30 days, which is the right amount for this individual anyway, so it doesn't impact them for that quantity limit. Then you have just a repeat of the drugs that were entered. So you can see the right dosages and frequency were entered for the medications. Then there's a section here which people just get confused with, but it's talking about Part B drugs not being covered by the Part D drug plan. Well, clearly that makes sense because Part B drugs are covered by Part B as in boy, not Part D as in drug. So that's all this is basically indicating. If you have chemotherapy drugs that are covered under Part B as in boy, they would be covered by your Medicare Part B. If you have a Medicare supplement, that generally pays the other 20% for those Part B drugs. And then at the bottom of this report, you'll see that the star ratings for these plans, and we've been doing this a long time and really never have seen like a 5-star drug plan. Most years it's 3 stars is kind of the range for these, 3.5. You may find one or 2 plans in a state that have 4 stars, but and then there's some lower ones as well that you got to be careful for. But you're not, to say there's going to be a great Part D drug plan out there that's going to have phenomenal service and everything's always going to be right, you're never going to have an issue. It doesn't really exist, unfortunately. So if you're in that 3.5 star range, that's kind of what we've seen is kind of the better. Again, sometimes there's a 4-star plan, but we very rarely, if ever, see a 5-star Part D drug plan. And it breaks down the ratings even further for you by additional metrics, so you can see what those ratings are as well. So lots of information here in this tool. Very powerful tool. Again, this is what we use to pick the most cost-effective drug plans for our clients. It's available to everyone on Medicare's website as well. I'm going to go back now and do one more example with a little bit more expensive medications to give you an idea of what that looks like. So we're going to keep in those other 2 medications we entered before, and then we're going to add an expensive heart medication called Xarelto. I'm just going to keep the default dosage for this medication. And then we're also going to add in an expensive eye drop, which is called Zedra. And again, we're just going to keep the default dosage and quantity for that medication. And then we click Done Adding Drugs. It's going to take us back to the pharmacy page. We're not going to make any changes here. Keep the same pharmacies. And now it's recalculating. So it's looking at all 24 of those drug plans again to calculate that total cost for the year, the premium plus the drug cost, and then sort the list based upon the lowest drug and premium cost. This is just a coincidence that this plan happened to come up as number 1 in the list again. Certainly not always the case. It's going to be just dependent on the medications that you enter. But here's the key here. Look at how much that number jumped, right? That total cost for the year, instead of being $80-something, which was really just the premium for the plan, now we're up almost at $3,000 for our total cost. That includes the premium, it includes the deductible, includes the drug cost, all in. That's the best one. That's the lowest total. So if we scroll down to the next one on the list, you can see this one is slightly higher at $2,691. Then it goes to $2,800. $2,852, and so on and so forth. If we go down to the bottom of the first page, we're up over $3,200. And if we go to the last page, we're going to see some big differences in the cost here. See, this one's over $9,000. All these are over $9,000. This is most likely because one of those drugs is not covered on these plans. And it's not to say these are never going to be good plans, but for this particular situation, these plans showing the very high cost would certainly not be an effective plan for this individual. Just kind of scrolling through, this is the second page. You can see a lot of these in those higher ranges as well. But it's all just very specific to the medications that you're entering. Now let's go back to that first page now, and I'm going to go back to that first plan again to go to the plan details, just to give you an idea of what it looks like now that we've got some drugs in there, some expensive drugs. So here we're showing all 4 of those drugs are covered, and the total cost for the year now is going to be, just for the drugs, this doesn't include the premium, it's going to be about $2,600 at the pharmacy, a little more than that if you do mail order. And if you scroll back through the list of information again, we've got the pharmacies again. Now we have the breakdown of yearly drug costs by pharmacy. So we can see now that for these expensive drugs, the Xarelto and the Zedra, you can see this is the total cost that you're going to pay for these. Again, this is just a model. If you don't fill these drugs every month, you're not paying this total, but this is a model that projects out. If you fill these drugs every month, you're going to pay about $1,500 for the Xarelto for the rest of the year and about $1,100 for the Zedra for the rest of the year. And you're going to actually have a small cost for the atorvastatin and lisinopril And we'll see that's because of the coverage gap and the catastrophic coverage for those drugs. So if we scroll to the next section where it shows the total drug and premium cost for the year, that's that total number on the first page. Again, that's how we pick the plan based upon the lowest total cost for the year. It shows us when we're going to meet the deductible, which is April. It's the next. In this case, because we added those expensive drugs, the first time you fill the Xarelto or the Zedra, you're going to have to meet that $505 deductible. So this is assuming we start, again, this report was run in March. So it assumes the first of the following month is April 1st. So we're going to meet that deductible in April in this example. And then it shows when you're going to reach the coverage gap, which is going to be also called the donut hole here. But it's going to be July, again, based upon an April start date, April, May, June, July, the fourth month. In this example, if you fill those drugs every month, you're going to reach that coverage gap in July. And then you're actually going to get out of the coverage gap into the catastrophic level by December in this example, where your costs will drop back down to 5%. The next section here shows, again, the estimated total monthly drug cost by month. So you can see there, it's not a flat, you can't just take the total drug cost for the year and divide it by 12. And when you have expensive drugs, it's going to jump all over the place because of the deductible. That first month, that's where you got to pay $593 because you have the $505 deductible, plus you have copays for your drugs. The next few months, May and June, you're paying $88 for your drugs. Those are the copays or the initial coverage level costs. Then you're reaching that coverage gap in July. You can see it's kind of like a partial month. You're not getting the full month of the coverage gap. But once you get to August, now you're in the donut hole, the coverage gap, where you have to pay 25% the cost of your drugs, which is that $347 number roughly per month. It will drop down once you get to December because of that. You're reaching catastrophic coverage. And again, we have other videos that explain these phases. But the report breaks it down so you can see by month what your estimated cost would be if you have those expensive drugs. And then you can break it down even further, like we looked at earlier, by pharmacy, by month. So this shows you at CVS for each of those drugs, what is that full retail cost? You can see the Zedra is over $700 a month and the Xarelto is over $600 a month retail. So those costs are what drive you into the coverage gap. And why you end up having to pay that 25% after 4 months into the year. The cost before deductible is really, if you haven't met the $505 deductible, you've got to pay the full cost of these higher tier drugs up until you meet the $505. Then after that, you have a $44 copay. That's the cost after deductible for those expensive drugs. The other two drugs are still zero copay for those low-cost drugs. And then once you reach the coverage gap, that's where you have to pay 25% the cost of these drugs. So the Xarelto is the $157 a month, and the Zedra is $191 per month. And then finally, once you get out of the coverage gap into catastrophic, you're basically paying 5% for those expensive drugs. And for the generics here, it's $2 for each per month. So you can verify these numbers and kind of look back on the chart. If you look here, see that 349.36? That's once you reach that coverage gap and you have a full month, you can see that's August through November, you're in that coverage gap. And the initial coverage level was the $88. So you can see that here as well, while you're in that, just for a few months, while you're in that initial coverage level, where you're paying that $88. So, and then again, it repeats for each of the pharmacies. You can see how if it differs at all. I'm not going to go through each of those here, but it's the same concept. And then the more drug information is going to be the same that we looked at earlier. But I really just wanted to give those two examples so you could see an inexpensive example and then a more complicated one where you have the coverage gap and the catastrophic there as well. So I hope you found this video helpful. If you did, please like the video, provide any comments or questions below so more people can actually see the video. You can also reach out to us at the contact information below this video if you have any further questions. Thank you and hope you have a great rest of your day. Take care.